She brought Hank in on a Tuesday morning. He was 6 years old, a big, friendly Labrador, the kind of dog who greets you with his whole body. She'd had him since he was 8 weeks old, and she told me, almost apologetically, that she gave him a dental chew every single day, had done it since he was a puppy. The expensive kind, the ones with the television commercials and the veterinary logos on the packaging. When I opened his mouth, the back molars were brown, not lightly stained, brown, with visible calculus built up in ridges along the gum line. One of his upper carnassials, the large shearing tooth just below the eye, had a hairline fracture running down the side of it. The pulp chamber was exposed. He had been chewing on that tooth in pain for months, and she had no idea. I removed the tooth that afternoon. Afterward, standing in the hallway before she came back to pick him up, I thought about all the mornings she'd handed him that chew. Confident, doing the right thing. The answer, the thing that would have actually protected those teeth, was available for less than $20, and it was sitting on a shelf she'd never thought to look at. That's what I want to talk to you about today. Here's something I think most people have never been told clearly. Dental chews are not a cleaning mechanism. They are a chewing mechanism, and those are not the same thing. Think of your dog's mouth like a kitchen sink with a drain that runs slowly. Every day, food particles and bacteria accumulate along the gum line, a sticky, invisible film called plaque. If plaque stays undisturbed for 72 hours, calcium from the saliva begins to mineralize it. It hardens. It becomes tartar, or calculus. And once calculus has formed, no amount of chewing removes it. You'd need a dental scaler, the metal instrument your vet uses under anesthesia, to lift it off the tooth surface. A dental chew can disrupt fresh plaque mechanically on the surfaces the dog actually bites down on, which is maybe 30% of the tooth surface. The rest, the back faces, the gum margin, the spaces between teeth, those are untouched. And the largest dental chew studies, including data published through the Veterinary Oral Health Council, show that even the best performing chews reduce plaque by somewhere between 20 and 30% when used daily. 80% of dogs show active clinical signs of dental disease by age 3. That number comes from the American Veterinary Medical Association. And in my 22 years of practice, I have never seen a patient whose dental disease was prevented by chewing alone. So if not the chew, what? I want to be honest with you about what this question cost me professionally, early in my career. I spent a long time repeating the same advice: brush daily, give dental chews, schedule cleanings. And I watched dogs come back every 18 months with disease that had progressed. I watched owners feel guilty for a non-compliance problem that was, in large part, not their fault, because daily brushing compliance in dog owners sits at 2%. 2%. That's not a behavior problem, that's a design problem. What I should have been talking about much sooner, what the research was showing clearly, were the alternatives that actually work at the biological level, not around the problem, through it. And the first one starts not with what you put in your dog's mouth, but with what their saliva is doing. When you fill your dog's bowl in the morning, you are making a choice about their saliva chemistry. Most people don't think about it that way, but it's true. There is a specific brown seaweed, Ascophyllum nodosum, harvested off the Norwegian coast, whose bioactive compounds, when ingested in fine powder form, are absorbed into the bloodstream and secreted back out through the salivary glands. Once they're in the saliva, they alter the metabolomics, the chemical environment, of your dog's mouth in a way that prevents plaque from adhering to the tooth surface in the first place, not scrubbing it off, preventing it from forming. And for existing tartar, it makes the calculus porous and softer, easier for normal chewing motion to disrupt. 2 peer-reviewed studies, including a 2024 review from the Polish Academy of Sciences published in the Journal of Veterinary Research, confirm this mechanism. The Veterinary Oral Health Council has accepted products containing this ingredient, meaning the independent evidence met their standard of proof. The dosing matters. For a dog under 25 pounds, approximately 500 milligrams of powder daily, about a small pinch, mixed directly into their food. Between 25 and 50 pounds, double that. Over 50 pounds, 1,500 milligrams. One important caution: this ingredient is naturally high in iodine. For dogs diagnosed with hyperthyroidism or currently undergoing radioactive iodine therapy, this is contraindicated. Check with your vet first. I have one patient, a 10-year-old beagle named Olive, whose owner started this protocol at age 8 after Olive's third dental procedure. Her most recent checkup was 14 months after starting. No new calculus requiring professional removal. Her owner, Margaret, brought in the before and after photos from the previous 2 years and laid them side by side on the exam table without saying a word. I'd like to know, have you ever looked at your dog's back molars? Really looked, not just a quick glance, and noticed what's accumulating there? That question matters more than most people realize. The second thing that actually works is one most owners never think to use, because it's associated with human dental care, and that's enzymatic toothpaste. I want to be precise here, because this is where mistakes happen. The enzyme system in pet-specific dental paste, glucose oxidase and lactoperoxidase, creates a controlled chemical reaction when it contacts your dog's saliva. It generates a small, targeted amount of hydrogen peroxide directly at the tooth surface. That peroxide disrupts the structure of bacterial cell walls, breaking down plaque chemically rather than depending on mechanical scrubbing, which means that even if your dog refuses the brush, even if all you can do is wipe the paste across the outside of the gums with your finger, the chemistry is working. For a dog under 25 pounds, a half-inch strip of paste. For 25 to 50 pounds, 1 inch. For large dogs, 1.5 inches. What you're looking for on the label: glucose oxidase and lactoperoxidase listed as active ingredients. What you're specifically avoiding: baking soda, which upsets the stomach and most dogs reject on smell alone. Fluoride, which is toxic to dogs at any real dose. And, this is the dangerous one, any product not specifically formulated for dogs. Which brings me to something I need you to hear clearly. Xylitol, listed on ingredient labels sometimes as birch sugar, is used in human dental products constantly. Whitening toothpastes, breath sprays, sugar-free chewing gums meant to protect human teeth. It is one of the most acutely toxic compounds a dog can ingest. In a dog's body, xylitol triggers a massive insulin release within 30 minutes. Blood sugar crashes to dangerous lows, and then the liver begins to fail. I treated a 3-year-old French bulldog named Beau after his owner gave him a piece of sugar-free gum, the kind she chewed for her own dental health. By the time he reached our clinic, his liver enzyme levels had risen above 12,000 units per liter. Normal is below 100. He survived after 5 days in ICU and multiple plasma transfusions. His owner never knew that the gum she kept in her purse was lethal to him. That story stays with me. Not because it's rare, because it's preventable every single time, and it still happens. I've put together a complete guide that goes deeper than a single video allows. Exact ingredients to look for, products that carry the VOHC seal of acceptance, dosing tables by dog weight and age. The link is in the description. Now, before I get to the third approach, which in my experience is the one that surprises people most because it has nothing to do with anything you put in the mouth, I want to explain something about the kind of damage that's hiding in the natural chew aisle. There is a test I teach every new dog owner and every vet tech on my team. It's called the kneecap rule, and it comes from the Veterinary Oral Health Council. If you would not comfortably strike your own kneecap with a chew, it is too hard for your dog's teeth. Antlers, real marrow bones, cow hooves. These are sold in the natural section of almost every pet store. They are marketed as durable, long-lasting, and good for dental health. Veterinary dentists, board-certified specialists who look at fractured dog teeth every day, are essentially uniform in their opposition to them. The carnassial tooth, the large fourth premolar, positioned just below the dog's eye, is the primary shearing tooth. When a dog bites down hard on something too rigid, The side of that tooth can shear off. A slab fracture. The exposed pulp chamber means the nerve is now open to the oral environment. It is painful in a way most dogs won't show you. They just stop chewing on that side. They get a little quieter. They eat a little slower. By the time it becomes obvious, the tooth usually can't be saved. The safe alternative isn't a softer chew category. It's a rubber toy with a hollow center or a dental diet that has been specifically tested and earned VOHC acceptance. The criteria matter, not just helps clean teeth on a label, VOHC acceptance, which requires independently reviewed clinical data. The fourth thing that actually works is chlorhexidine, and I want to explain why the form matters more than the ingredient itself. Chlorhexidine gluconate at 0.12% concentration is an antiseptic that binds to oral tissue and tooth enamel. Once it binds, it disrupts the cell membranes of plaque-causing bacteria for up to 24 hours. One application, once daily, and the antibacterial effect persists through the next feeding. It's used in human dentistry. It's been studied extensively in dogs. The form that works for the majority of dog owners is the pre-soaked dental wipe, not a brush. A wipe. You fold it, run it along the outside of the gums, and you're done. 15 seconds. Most dogs tolerate it because there's no toothbrushing motion, no toothpaste taste to negotiate, no water, just contact. What you're looking for? 0.12% chlorhexidine gluconate on the label. Available at veterinary clinics and online veterinary pharmacies. One thing to know, prolonged daily use can cause a harmless brown cosmetic staining on the tooth surface. It doesn't damage enamel. It wipes off at a professional cleaning, but it's worth knowing so you're not alarmed when you see it. I have a patient, a 12-year-old standard poodle named Arthur, whose owner David started this routine at age 9, after 2 surgeries in 3 years. David is 71. He told me the wipe was the first dental routine he could actually keep up with. Arthur's last 2 checkups required no extractions. For a 12-year-old dog with his history, that is not a small thing. The fifth approach is the one that most people either skip or overcomplicate, and it has nothing to do with any product. It's what your dog is chewing on every day and how long they're doing it. The mechanical action of chewing, real chewing, sustained chewing, does produce friction against the tooth surface. The problem is that most modern dogs don't chew that way. Kibble is swallowed. Wet food leaves a film. Even treats are gone in seconds. There are dental-specific diets, large kibble formulations with a fiber matrix that requires the dog to bite through the piece rather than crush it, that have earned VOHC acceptance by demonstrating a measurable reduction in plaque and calculus in controlled trials. The size and texture are engineered deliberately. This isn't a marketing claim. The VOHC seal means the data was reviewed independently. For a dog who refuses every other approach, this is the one I recommend as the foundation. It doesn't require a routine. It doesn't require a cooperative dog. It happens every meal. Here's what connects all 5 of these things. Every one of them is working on the same underlying process, disrupting the 72-hour window before plaque mineralizes into calculus. Some of them do it chemically, at the bacterial level. Some do it mechanically, at the tooth surface. One does it from inside the bloodstream through the saliva. But the target is the same. That narrow window of time before soft plaque hardens into something that requires a steel instrument and anesthesia to remove. The reason dental disease progresses silently in so many dogs is not that owners don't care. It's that the advice most people received was built around a single intervention, daily brushing, that only 2% of owners can sustain. Everything else was treated as optional. It wasn't. It was just underexplained. Hank's owner came back 3 months after his extraction to show me something on her phone. She'd started the seaweed powder and the enzymatic wipes. She'd replaced the dental chews with a VOHC-accepted dental diet kibble, and she'd photographed his teeth herself, carefully, with a flashlight, the way I'd shown her. His remaining molars were noticeably cleaner. She said, "Why didn't anyone just tell me this clearly years ago?" I hear that question more than I should. Not because the information doesn't exist. It does, in journals, in VOHC databases, in conference presentations I've attended for 2 decades. But it doesn't always make it into a 10-minute appointment. There isn't always time. That's the gap I'm trying to close. What I'd ask you to do is this. Send this to one person you know who has a dog. Not because it's a share button, because 1 in 5 dogs develops periodontitis severe enough to affect organ health by middle age. The bacteria that lives below the gum line doesn't stay there. It enters the bloodstream. It reaches the kidneys, the liver, the heart. The research on this is consistent and it is not subtle. The people who catch it early aren't lucky. They just had access to better information. Before you change anything, diet, supplements, your dog's dental routine, bring your vet into the conversation first. They know your dog's history, their blood work, any conditions that would change what's appropriate. Bring them better questions. Show them what you're considering. That's how this is supposed to work.